does this matter in dentistry, specifically in a clinical setting? How would you answer that?
Because I think it changes the way how patients interact with dentistry and how dental clinicians will continue providing dental services. So I think it will over time fundamentally change in a good way how we are practicing, so to say. And that's why I think it matters, if that makes sense, right? And I think we are seeing the first signs in dentistry already happening now, right? You and we both, Alan, have been working on Detect AI, which is in Dentrix offices, and Vid AI, which is essentially already changed the way how, for listeners who don't know, we work together on when you take your x-rays, we automatically identify disease such as cavities, bone loss, calculus, you name it. And then we show it to the dentist on the one side to have a quick look and save them time and stress. But then also we show it to the patient so the patient can have a second opinion. And what we're seeing is that there's a much higher case conversion rate. And so the production goes up, but also the patients get the right treatment at the right time and doesn't delay necessary treatment. So that's in a nutshell what we're doing. And we are already seeing, Alan, that the way how treatment plans are presented has already changed. Because at this point, it's not on a gray blob. On this point, you're using AI to present treatment to patients. And that has happened now already for the last 2 years. And we have tens of thousands of dental clinicians using it every day. I think that trend will just continue and even accelerate. To your point about the hype curve, and we can go there in a second, I think what I just explained existed in healthcare for a long time, right?
Yeah.
So there is, I worked before actually on breast cancer detection and pneumothorax and so on, so in healthcare. And I think it took us over a decade to go from AI research and breast cancer detections towards that it's actually used with your radiologist to support mammographies on identifying potential breast cancer, right? It took us 10 years. But now in dental AI, it took us 3 years to go. Alan, if you think about this, the two of us, we did like literally the first tests with Detect AI and Vid AI like 3 years ago. And now we are 3 years later, and it's in thousands of practices, tens of thousands of doctors using it. So this took us 3 years. And I think what we are seeing in the future AI modules, which automate treatment planning, which automate claims, which automate a lot of administrative tasks in the dental office, will be adopted at a much higher rate and will fundamentally change the way how we practice. And I'm happy to go into that, but that's I think, Alan, the long-winded answer to what's like why I think it matters.
I gave it to you because I recognize and know your passion for that. We're aligned. I see the same thing. I would add one thing to I build on what you would say by it allows consistency. It makes things very, very consistent in a clinical setting where the outcome is very, very consistent. And one fun point here, not being a dental practitioner myself, I've gone to the dentist before and been told I have a cavity or I have something and I don't feel any pain. Do I really? Like, are you sure? And I've never really had the courage to really say a lot about it. But when you have that second opinion, when you have, see, it's right here, like it, no question, it's very consistent for me. So thank you for answering that way. Well, maybe for a minute, I want to kind of briefly talk about the concept in a non-clinical setting about agentic AI and some of the use cases we see in dentistry. So in dentistry, we see lots of uses for agentic AI. And as a reminder, we said earlier, agentic AI is really an agent performing a task, correlating data, making decisions. And you could do that in a clinical setting, and to some extent, what we talked about is agentic. But some other use cases of agentic AI are, imagine a use case where you cancel an appointment. And instead of a human having to call the person back and find out what time works for them, we can do that with AI. And it could be voice-enabled AI, where you get a phone call. It could be a series of text messages. There's lots of third parties that do this right now. We're actually here at Henry Schein One. We have some of this functionality that we'll be releasing shortly that does some of these same things. But that's an example of an agent doing something, agentic AI. Another good example of that is where we see lots of players is in the revenue cycle space. Filing claims, who's eligible for what, attaching what to which claim to get with the highest probability of being approved, et cetera. There's a whole lot more detail there, but that's another great example of agentic AI as it's applied in dentistry. What are some others you can think of or talk about, Florian?
No, I totally agree. I think there are many, and I think if you are a dentist or a hygienist, you should start thinking as well about every tedious, repetitive manual task, which is also prone to error, because that's who we are, right? If I would submit claims, for instance, or get all my claims documentation together, where I need to go into a PACS system, like an imaging system, into my DEXs and get the right images, and then I need to go and get the doctor's notes, and then I need to put this all together to submit the claim. If I think about that, for instance, Alan, that is a tedious task, right? You need to have almost like 80 clicks. It's 10 different steps, so it's tedious. It's repetitive. I need to do this for every patient which has a high dollar value code, such as crowns or whatnot, and it's error prone. And I'm talking about myself, but I can tell you, Alan, I would be the worst at that job, right? Because I'm not process driven. I'm not super detail oriented. So all of a sudden, right, like I would probably mix them up. So if you can think about all these tasks, I think most of these tasks will be solved in the next 12 to 18 months, actually, I believe, with AI or agentic AI. I think like then the question is, right, what you said is AI like automates things. Agentic AI automates complete tasks, so to say. And I think I can see that for all these tasks. The claim submission and the claim, getting the claims together. I think that's like another one. I think the patient engagement and the scheduling is another one. I think the treatment planning is another one.
Yep,
so just think about every tedious, right? Exactly. And we are working also with Dentrix on automating some of those things, right? So think about every tedious manual process task. And here's the thing which is important to me, Alan. I think I was like many years in the medical school actually before I started my entrepreneurship journey. But I wanted to become a doctor. Yeah. So I wanted to become a doctor. And one of the reasons why I dropped out of med school was that I realized, like, as a doctor, I spent a large chunk of my time not with patients, not with things I was excited about, but instead sitting in the back office to write doctor notes, to make sure that everyone gets referred to the right thing. And that is exactly the same thing in dentistry, right? Dentists spend hours and hours per day on administrative redundant tasks, and the same the front office desk. So imagine a world, Alan, where we can automate all of these tedious manual process tasks and give the time back to patients and to dentists. And they can spend much less time with that, but instead much more time with the patients or much more time at the golf course. They can decide, But
so hold on, let's talk about this. This is important. What you're telling me, what you're saying, this is crazy. Artificial intelligence will make it so dentists can actually care for their patients. Is that what you're telling me, Florian?
Yeah, exactly. It's like the number one thing. It's like a number one thing. What's interesting? Like one of the biggest feedbacks I got from dentists about all our technology and the products we're developing, in particular the products which are helping to save time, is not actually that they say, oh, this helped me a lot for myself. What they are saying is like, because you have all these automations, I was less stressed when I talk to my patient because I was not multitasking. I was not like looking at the screen, putting in the treatment plan while I also talk to the patient. No, instead, I was just fully focused on the patient. And I was less stressed because I didn't multitask. And the patient loved it much, much more because he felt I had all the attention, right? And I think that's a very valuable future to work against or to work towards. I mean,
I think so. I think I agree with you.